Quick TV, bridging information gap.
I'm Lewelin Chida. I'm a radio producer presenter. I'm here for the VCAT workshop here at Mashika Day in Banket. So it's been quite informative and very enlightening and also empowering. The workshop that we had on safe abortion. It was very important for us as broadcasters to learn the correct terminology when reporting issues to do with safe abortion as well as SRI, HRI issues. Um, it was also very enlightening to know and also get to understand and notice the type of mistakes that we're doing. Especially for me, my biggest takeaway was the terminology. I got to understand and grasp quite a few of the correct terminologies that I need to use when reporting issues to do with SRHR as well as safe abortion. It also got me to understand that us as media personalities, editors, journalists, it is of utmost importance as well as our responsibility to shape positive narratives when it comes to issues to do with safe abortion. I think I keep on mentioning the term safe abortion because I used to just think that abortion is abortion until I understood and distinguished the difference between just abortion and safe abortion. Also, it was also of utmost importance for us to understand the law in accordance to safe abortions, which is the termination of pregnancy law. So, as I mentioned, it was of importance for us to know the correct terminology to use. And from my understanding, and I think from also everyone's understanding when it comes to the Termination of Pregnancy Act, we used to think and also report that abortion is illegal. But I got to understood that that's not the correct term to use when speaking or talking about abortion. The correct terminology being abortion is legally restrictive according to the Zimbabwean law. It's not entirely illegal, but restrictive, which is the correct terminology when it comes to the Termination of Pregnancy Act.
My name is Ngonizashe Dapira, and I'm an online publisher with Eastern Times based in Mutare. We are really grateful for WAG for organizing this function for editors. It's a learning curve for us. It's a time to update some information that we already know and some that we didn't know. We are in a transitional stage in Zimbabwe where we are trying to amend certain tenets in the Termination of Pregnancy Act. So as media, we are really looking forward to such platforms where we get to learn what is happening as parliamentarians are debating, as civic society organizations involved in advocacy work are also pushing for certain tenets to be changed, certain new facets to be added in the discourse of termination of pregnancy in Zimbabwe. So here we learned a lot as editors from new glossary terms that are being used as we are talking about termination of pregnancy, which do not really prejudice anyone. And we're also learning about what is being done currently towards the initiatives of reforms. So we really are grateful for this initiative, and we hope to see more of these training programs being promoted because we learn every day. Times are changing, and we don't know it all as media practitioners, but we actually want to learn from experts who are doing research. I think in a nutshell, we are looking forward to this transitional period, and we are looking forward to seeing positive developments in terms of the amendment of the Termination of Pregnancy Act in Zimbabwe, as we are seeing some human rights violations in selective application of people who are deserving of being given the opportunity to decide by themselves that they want to terminate a pregnancy. People have got different social, economic, and religious reasons after they find themselves to be pregnant. So we just need to respect their decision and not be guided by a few policy frameworks uh, towards making that decision.
My name is Loveness Rukuni. I'm the director of Women's Action Group. We are gathered here because Women's Organization is an organization that was formed in 1983, registered in 1987. We have 4 pillars: gender-based violence, a transformative women's leadership. We also deal with SRHR, which is sexual and reproductive health. We also do climate change and public health. So today we are here because of the SRHR pillar, which we are discussing, and we have realized that the media is not very familiar with this SRHR subject. So we were discussing, and whilst we were in this, there's also the issue of termination of pregnancy, which wrong language is being used. Some say it's illegal, but however, we've got 3 circumstances where the termination of pregnancy is allowed. That is rape, incest, and when there's a threat to the pregnancy, like a deform, if it's delivered, the baby can be deformed to the extent that it will not be able to live, or the health of the mother is threatened. Those 3 circumstances are allowed by the law. However, this law is a 1977 law, and I think at the moment even the parliament has also raised the issue that shows it's long overdue to be reviewed. But today we are not necessarily dealing with the review. We are dealing with what is legal, which are the 3 circumstances that I have just mentioned, which we would want the media to report correctly. Because whenever there is termination of pregnancy, everyone would think it's illegal. No, it's not illegal. We want the country or the girls and women to know that there are circumstances that they are allowed to terminate, and then not just suffer when the law is there. So this is why we have the media here, so that they have the correct narrative of the issue, to report the correct position and use the correct language. That is the termination of pregnancy, not killing babies. Not because when we terminate, it's just abortion. It's not killing children, because there's actually the law has actually stipulated the period which is allowed to terminate the pregnancy before it's a baby. So we want them to have the correct narrative when they are reporting. When a person has unsafe abortion and dies, this contributes to the maternal death of the government. And it's also a cost to the government, because when they have their unsafe abortion, they then come to the public health institutions for medical attention. No one will say we have had a safe abortion. It will be just maternal health, or a miscarriage. So the country will go through high cost on that, rather than just having the normal procedure that is less expensive and good for our economy.